watching Let's Chat.
I'm proud to say I'm coming up on my 1-year anniversary of having a brand new hip, courtesy of the folks at Erlanger Medical Center and our next guest here on Let's Chat. It is Dr. Mark Freeman. Dr. Freeman, good to see you. Good to see you in my house instead of me being in yours.
I understand.
Dr. Freeman you're the chairman, or you oversee the orthopedic side of all of the surgeries at Erlanger, correct?
I'm medical director for the Erlanger Orthopedic Institute, yes.
Medical director. And you guys, past couple of years, I guess, you have undergone this new orthopedic wing, which is just, it's phenomenal. Tell me what all went into that.
Great. So we have 6 new operating rooms, a whole floor for elective orthopedic patients to help make that experience of taking time out of your life, your family taking time out of their life to come in, have elective surgery, get quality care, fast recovery, and then get you home.
Which
it'd
you
be a
did.
better experience than just a typical hospital stay.
I was in and out in 28 hours, and that's from the time the car door shut going in to the car door shut coming out, and I had no idea it would be that quick of a time sequence. No idea.
It's not often been that way historically, but as technology advances, rehab protocols advance, the length of stays have gone down, but our job is to make that still satisfying for the patients and safe for patients.
Nick Saban, University of Alabama head football coach, underwent surgery yesterday to have his hip totally replaced. But there was kind of a difference between what I had and what he had. I think what he had was robotic hip replacement. I'm not sure how that works.
I just became aware of that very recently myself, and robotic surgery is new for the hip replacement or joint replacement field. There have been iterations in the past.
Right.
Hip replacement done the traditional way is one of the best operations in all of medicine. In fact, in the 1900s, the late 1900s, it was recognized by the American Medical Association as the best surgery, the surgery of the century for patients. You take patients who are extremely debilitated, have pain every day, and approximately 98% of them live happily ever after without pain. So there's a high bar to jump over to make it better. And so whether it's technology, engineering, robotic surgery, minimally invasive techniques, all of these things are being developed, but even the traditional surgery is fantastic.
When you first heard of robotic surgery as it pertains to hips, what was the first thing you thought?
First thing is you don't want to do any harm, right? And you're taking a great operation, but you want to make it better. So maybe you can do it through smaller incisions, maybe you can do it more precisely, maybe you can navigate the parts to be in better alignment.
Right.
And then frankly, there is a certain amount of patients expect change and improvement in things, and robotics sounds good.
How long is the typical patient out of work, or how long is it before they can return to their typical normal lives that they had pre-surgery?
Sure, I think most hip surgeons would say after 12 weeks there are no restrictions whatsoever for almost all surgeons, all patients. I would say most patients are on a walker for a week or so, a cane for a week or so, and back to work depends on the job description.
Right.
But I would say most patients within 4 to 6 weeks are back to work.
4 to 6 weeks. And 20 years ago, that time frame was a whole lot broader.
Many patients were in the hospital longer than a week when hip replacement was first developed in the 60s and 70s.
How do you know if you're a candidate for that?
Sure, so most patients have groin pain, front of the thigh pain, some buttock pain occasionally, and they limp. And so when people hurt every day and get to the point where they can't function and the quality of life isn't good, then hip replacement becomes an excellent option.
See, I had all of those symptoms, and never would I have thought it was a hip thing.
Very commonly, patients think it's their back or they think it's a strained muscle.
Right.
Many patients go to their primary care doctors for evaluation for hernias or other things. In reality, hip arthritis is very common.
It's just amazing, and I can tell you if you're considering it, I give them AAA pluses. It was a great experience, start to finish. So you're the man. I think we have a picture of my new hip, but we're running out of time. There's my new hip. Well, actually, it and I are a year old. So anyway, Dr. Mark Freeman, thank you so much. And to show you how good this guy is, if we weren't running out of time, I would show you my hip scar right now. Jess is going, oh, Lord, no, anything but that. So anyway, Dr. Mark Freeman, thank you so much. Find out the great work they're doing at the Erlanger Orthopedics. It's easy to find. Call them at 778-ORTH 888-778-ORTH, or check them out at erlanger.org/ortho. Stick around. We have more of Let's Chat right after this.